Good afternoon, Hattiesburg. Thanks for joining us for this COVID-19 and City News briefing for Wednesday, October 7th. Because we wanted to get some numbers together and we have some things we want to share with you because there are some concerning pieces of news tonight. We'll start with today's test. These are system-wide numbers for Forest General, Merit Health, Wesley, Hattiesburg Clinic, Simrai, and the Moffett Health Center at USM. As of this morning, 66,126 tests have been conducted. 7,185 of those have come back positive. 58,375 have come back negative. 567 tests are currently pending. In the hospital today, between Merit Health, Wesley, and Forest General, there are 51 people who were positive for COVID, with another 11 under investigation. And of these 51, 14 are in the ICU, slightly over the average for the last 2 weeks. If you look at this graph, you can see as we declined our cases in August and much of the way through September, we almost got down to 40 a couple of times. What we've seen, though, however, is we've seen a quick spike in hospitalizations, and what we normally see is that when you have new infection numbers and a lot of new positive cases and a surge in those will eventually translate into hospitalizations. They follow those by a week to 10 days. You start seeing the hospitalizations creep up, and that's what we're seeing now. Statewide today, 975 new cases, 14 new deaths. None of those deaths were in Forest or Lamar County. New positive cases locally. Of those 900 plus cases, 60 are from our metro area, 36 in Forest County and 24 in Lamar County. Totals to date, 2,714 in Forest County, 1,927 in Lamar County. Our 5-day average is where we take the number of new positive cases and we average it with the 2 days prior and the 2 days after, and you can see, except for one dip on Monday, which reflected the Sunday test numbers, we've been on an uncomfortable rise. Last Saturday, we had nearly 100 new cases between Forest and Lamar counties, and again, you saw today another 60 that were added, so that 5-day average is starting to go up again. The inside 14-day number. This is the number where we take the number of people who received their positive test in the last 2 weeks, because COVID-19 typically has a lifespan of 14 days or fewer. This gives you a basic estimate on how many active cases you could have in your community. And in Forest County, that number is up to 289. And in Lamar County, that number is 272. And if you look at this, we had a great September for most of the month, getting down to under 200, both counties combined. Now that number is well over 500. We're well past 550. Both counties are nearing that 300 mark each in new positive cases, and that's a problem because look at just a week-over-week comparison. Last Wednesday, we were at 248 in terms of new positive cases in Forest County. That number's up to 289 now, so an increase of about 40 there. Lamar County, 214 last week, 272 now, so almost an increase of 60 there. And so you're seeing, again, over 550 potentially active cases in our community. Hospitalizations, this is the other piece of it, as I mentioned earlier. A week ago we were at 41, now we're at 51, so an increase of 10. After a steady decline, we're seeing some pretty marked increases. ICU admissions still at 14. What we often see, though, is, again, a surge of new positive cases, then a surge of hospitalizations a week to 10 days after that, and then you start seeing some of those who are going to have adverse reactions and end up in the ICU or worse about a week after that. Our goals continue to be, since we started, protecting the vulnerable, people over the age of 60, people with underlying or chronic health conditions. We endure inconveniences, and we go the extra mile to protect our fellow citizens who could be vulnerable. When we do that, we can prevent overrun of the healthcare system because you're not admitting as many people into the health system. So if and when you need healthcare for COVID or some other reason, there is capacity and manpower to take care of you. And if we can do those two things, we can continue leaving our economy open while still prioritizing public health. We lean on the widespread availability of testing, the wearing of masks, watching our own data, listening to all voices. But watching our own data, there's a couple of things that we kind of take away right now. That inside 14-day number, that is the number of potentially active cases. Again, people who have received their positive test result within the last 14 days. We're at our highest point right now in Forest County since August 15th. The majority of those, what we'll talk about, tend to be from younger populations. Lamar County, they're at their highest level because they were ahead of Forest County in seeing a decline in August, but they're now back at their highest point since August the 9th. This all came on the heels of that really bad July when we saw the big spikes and we had to pull a lot of things back. Combined, as metro area, we're at our highest point since August the 12th. Another thing is we're seeing is over half of current cases in the city of Hattiesburg, and again inside 14 days, are believed to be college students. We know this because emergency management reports those numbers to IHL. We also know this because we can look at the Moffitt Health Center testing numbers coming out, which students will be having a talk with you, hopefully on Instagram in the next day or so. But this is a problem. This is not just Southern Miss. There are a few William Carey students as well, but we're seeing a lot in Forest County that are college students. Going back to our factors that we lean on, that last piece, listening to all voices. Of course, today is Wednesday, so we had our regular conference call with all of our emergency management officials, all of our local elected officials, our school districts, our universities, our tourism, those kind of folks. And as we talk today, there are a few things that I'll bring you up to speed on. First of all, positivity rate is up. Positivity rate, of course, is the percentage of total cases that come back positive. Typically, when we see the positivity rate go up, that's when we're seeing more hospitalizations, more ICU utilization, more deaths. The peak of positivity rate was around 15% back in July. Right now, 2 weeks ago, on the 20th of September, 7.3%. Last week, it went up to 8.22%. Already this week, we're at 9.94%. And talking to Merit Health Wesley, a lot of their outpatient clinics, positivity rates yesterday in the double digits. Total number of tests are up, and this is not just pre-op tests. These are people who are symptomatic or who have been exposed, who are going into the cough and fever clinic and wanting to be tested for COVID. And so when you combine the total number of tests and positivity rate, you're going to see more infections. We're also seeing noticeable but slow growth in COVID hospitalizations. Again, just showed you 10 over last week. This same time in hospitalizations, eventually some of those are going to end up in the ICU because hospitalizations tend to trail new infections. And finally, hospitals are mostly full, even without without even the full peak we saw back in July of over 100 hospitalizations. We're only at 51, but they're already full, and that's because people have put off health care. People, whether it's ER beds, right now in Forest General, 46 of 48 ICU beds are full as of this morning. Merit Health Wesley, they have 18 ICU beds. They were past that. They were in their backup mode. Only a handful of acute beds at both hospitals are open right now. And finally, the percentage of new infections from people under 20 is going up. So this, if you're going to take a positive thing, understanding that we don't want to see anyone getting infected, but if younger people tend to have less likelihood of an adverse reaction, and just some numbers on that, the week of September 20th, 14.7% of all new positives at Hattiesburg Clinic were under the age of 20. Last week, that jumped to 20.2% of all new positives were under the age of 20. And this week, just in 3 days, that number's already at 21%. So the big takeaway here is we're at a critical point for both counties. We do not want to endure a July-type situation, particularly in October when the weather's getting nice and there are events going on, even though they may be different than we're used to. We want to see Halloween and trick-or-treating. We don't need to see numbers run away from us like we saw in July. And so college students really need you to act responsibly. You need to have your mask on. Even if you're not on campus, if no one's watching you need to have your mask on because you can transmit this to someone who can transmit it to somebody who's vulnerable. Furthermore, as I mentioned a few weeks ago, the state health officer told all the college town mayors that if they start seeing large increases, exponential increases among college students, then a recommendation will be made to send college students home for the semester. And you don't want that. The university doesn't want that. And our city economy certainly doesn't want that. And so it's time to behave responsibly and do the right thing, whether you're in class or out of class. Some city news. We're continuing to watch. If 2020 couldn't be more interesting, we're now at Hurricane Delta in October. And so as of 12:30 p.m. at that briefing from the National Weather Service, the course of Hurricane Delta has shifted more to the west. We hope to avoid this. However, we know these things can change course very quickly. As of now, if this track held, Hattiesburg will be looking for probably 2 to 3 inches of rain, wind gusts up to 40 miles per hour, possibility of a spin-up tornado. But again, we've seen this summer that these things can change course very quickly. So please watch both your emergency management associations, whether you're in Forest County or Lamar County. Watch their Facebook pages. Of course, stay in touch with our media partners and all the great weather folks at WDAM. Finally, a couple acts of courage for you today. 2020, in all of its infamy, there's one good thing. 2020 marks the 25th anniversary of Miss Osceola McCarty making her $150,000 planned gift to the USM Foundation. This represented the majority of her life savings, and since that scholarship's establishment, over $500,000 has gone to South Mississippi students to attend college at Southern Miss. There's a virtual celebration of that planned tomorrow at 4 p.m. You can tune into that, usmfoundation.com. They'll be doing a very special commemoration of that event. Also, we mentioned that a lot of our nonprofits are having to change the way they do their events for this month. And Children's Center, who does such great work working with speech and other developmental issues with our, especially our pre-K students, both at their center but also in the outpatient setting, they are doing a cooking demonstration, a virtual cooking demonstration from Kay Dixon and Robert St. John. You can tune into that and learn all about the Children's Center and what they do at facebook.com/The Children's Center USM. That's Friday, October 9th, this Friday at 6:30 p.m. As we continue in the week, I know this was a lot of potentially bad news. Do the right thing and wash your hands. Take care of yourself. Wear a mask if you go out in public. Do only what is essential, and remember, you're safer at home. Have a good rest of the evening.